Hello, my name is Ben and I'm going to talk a little bit about Venablock. It's putting it together, its application, potential problems and some best practice. So, this Venablock comes in a pack. It's indicated for great saphenous vein, short saphenous vein, and it comes in a pack. Included in the pack is a sheath, a wire, 2 needles, a gun and a delivery catheter. I'm going to tell you how to put it together, some of the planning you may need to do for a patient, and some of the potential issues. So, I open the pack. Inside we've got a cover over the top here, which can be a little hard to open under sterile conditions. We'll pop it off, discard the top layer. As you can see, we have a gun, a catheter, and the first thing I do is I just check the light is working on the catheter. To do this, I just quickly switch it on. Here you can see the light glowing through the catheter there. I switch it off again to conserve batteries. You're also kitted out with a glue gun. The second thing I do is to push this button down here and pull back fully. It should always come fully back, but it's very important to do so. This gun is calibrated for 2 mils of glue, and each pullback is delivering 0.3 of a mil of glue, which is enough to do 10 centimeters. Okay, so I pull that back, that's ready to go now. I put that aside now. You can prep the sheath. This goes through a 6-French sheath. It comes together. Prep the sheath as usual with saline. You can put that through the port here. You push together. The only thing to note about this sheath, which is a little unusual, is that this is a twist to lock, not a usual clip in. I'm going to put this aside. What else we come here? We have a syringe inside here. It's a 3 mil calibrated syringe. You can see on the side here. The only thing that's slightly different about this syringe, it's very similar to the ones you get in your practice all the time, is that the wings are slightly thinner. And the reason why they're slightly thinner is that it enables a smooth application into the gun. Your 3 mil syringes in your practice will go into the gun as well, but it's not so smooth. It just requires a little bit of pushing and fumbling, which is not ideal when you've got a syringe full of glue and it's extremely sticky. You've got 2 needles. They're both, one's for draw up, one is for puncture if you like, or you can use whatever one needle you like. These are 18 gauge needles. You've also got a wire for access as well, access with the sheath, which comes in the pack. That's a standard wire. Okay, so now we're ready to prepare the device. What you'd normally do is grab one of the syringes, and put the needle on top for the draw up needle. Now this is not the glue. I've dyed some water pink to enable us to see on the video a lot better. And what we're doing here is we draw up 2 mils. The glue comes in two 1 millimeter vials. Get rid of any bubbles. You can see the bubbles there. Give it a tap. And the idea is to try not to get too much glue all over your fingers. Of course, it's very sticky and it polymerizes with skin, blood, and slowly with water as well. So now we have a 2 mil syringe with a glue inside it. We now need to connect it to the gun. To do that, I recommend sliding in first and pressing the back of the plunger into the gun here. This will then pop across. And now there's a technique to this which I recommend. And it's simply if you're right-handed, with your left hand, grab the gun as so. With your right hand, make a little grip like this, push the syringe in and rotate it round. That locks it into place very nicely into place. Now, the reason why I'm saying it looks very, very easy for myself, but when you've got gloves on, sometimes that can be a little tricky, and if you warp the wings on the syringe, it can become a potential problem. Now that's ready to go. You can put this down for a second and take out the catheter. The only thing I'd say about taking out the catheter, you've got a protective catheter over the top of it. I wouldn't pull too hard on the actual catheter. It grips it a little bit, so just take it out nice and slowly I've seen people in haste bring out the catheter before and just pull the top off very quick. Now you've got a catheter here. You can see the calibrations on the catheter. They're 1 every 2 centimeters, and they can help as well if there is a slight problem later on. It's also helpful for good measurement and so forth. Okay, you've got an atraumatic tip with a light on the top of it. Now to attach it, what you do is you stabilize the gun and the syringe with your fingers. Push the thing firmly down and do 1-2 rotations should be sufficient. If you start doing more and more, it can sometimes wind it through. So it's very important to get a nice push and a nice 1-2 to get a nice firm connection. Now to prepare the catheter, the only thing we need to do is get the glue along the length of the catheter to around 10 to 20 centimeters from the tip is ideal. Now the reason why you're doing this is you're creating an air bubble. You want to, this is a very important part of the procedure. This air bubble acts as a buffer, so when you push it into the patient, the blood will not creep up the catheter and then potentially react with the glue in the catheter. The other reason why we do this is if you have it too little, the air can compress and the blood will creep up, and then when you do advance the glue, it will polymerize in the catheter before it gets to the patient's GSV. The other thing is if you do too much of it and it spouts out the top, as soon as you push it in through the sheath, it will react to the blood, and by the time you get it to the GSV, it will have polymerized again. So this is a very important part. So it's good. It's probably the best part is to take the most time with. To advance the glue along the catheter, you simply push the glue gun down once. Is the idea. You can see it going along the catheter, and the idea is that after 1 trigger pull, it should be around 10 or 20 centimeters. Now you can see on this one already, actually the pink is actually about 13 to 35 centimeters from the tip. So what I'm going to do is do a slight depression. You can see a slight depression of the trigger to push it up a little bit further forward to prepare it. Now we're at perfect optimal level, 20 centimeters from the tip to do the procedure. Now that's ready to go. This won't polymerize with anything, it's not reacting or anything. You can put this aside and wait for a while. You're ready to go for this. Once you've gained access, you've got your sheath in place into the whatever segment, it's good to start planning what you're going to be actually doing. If you're doing 50 centimeters of vein, you're going to do 5 trigger pulls. So you can get an idea of how far you're going with the procedure as you're going because of the markers on the thing. Now, to push the sheath in, push the catheter through the sheath and up our imaginary vein here and along the vein. Now, there's some considerations. You don't have a wire on this one, so it's very flexible and device, and generally you can go through most tortuosities, but there's some tortuosities that you won't be able to get through. Now, once we're in place, we are up at the saphenofemoral junction. We have our kit in place. We want to come 3 centimeters back from the saphenofemoral junction. You want to confirm this under ultrasound. You can of course use your light to locate this as well if you're looking through the light for the patient. Now the luminosity of the light varies depending on the patient's size and the depth of the GSV. Some patients' GSVs are deeper or more superficial than others. Also, the illumination of the theatre can obscure the light on this one. So now we're ready to go. We're 3 centimeters from the junction. We're ready to deploy. What I suggest doing then is pulling the sheath out over the catheter so that you don't have to worry about pulling the sheath or gluing the sheath later. So now the sheath is out of the patient and only the catheter's in the saphenous vein. So what we've got to do now is probably the tricky, most skilled part of it. And it's a bit like it's rubbing your stomach and tapping your head, I suppose. The best thing to do here is what you've got to do is you've got to depress the plunger over 5 seconds. So I always suggest to count 1, 2, 3, 4, 5 in the second increments. As I do so, I've got to press the plunger and I've got to pull back 10 centimeters. Now you've got considerations to keep in mind is that you've got a little bit of gap of air here. So when initially it's coming, as you can see from here, there's no glue coming out in the first few seconds, and then you've got to start bringing the glue back until we get to 10 centimeters. And that's a nice trail of glue. It's not like Venacil. Once you've depressed the plunger fully, you've got to do it again. The idea is that you're creating this trail of glue down the patient. Now problems can go wrong, and as this is happening, your assistant will be compressing, following the lights that you can see through the vein, be compressing this vein closed, and it will be sticking it shut. Now there's problems with it, is if you can't see the light, one of the problems is, well, if you've got these markers on the patient's leg, you can use the catheter markers, one for every five markers means 10 centimeters, so you can get a better idea from that if you can't see the line. You also know that you've got 5 depressions to do this whole length, so you can if you after 2 compressions, you've got a good idea you're going to be around this area, so you can compress to there. Okay, we'll continue on with this patient, and we're going to continue on 1, 2, 3, 4, 5, and go again. 1, 2, 3, 4, 5, and this rate, as I've given you here, until you pull out the patient. But the 1, 2, 3, 4, 5 for every 10 centimeters can vary. If you've got a 2 millimeter vein, you can want to go a little bit faster. And this is where the technique comes into it. If you've got a 14 mil or a 20 mil vein, you're going to want to go a bit slower and give it a little bit more glue. So there's a little bit of variation in your technique and so forth from there. So that's what we're trying to do with the glue. We're getting a long trail of it. We don't want to, and this is continuous. So I know I stopped in this presentation, I stopped just to discuss things, but you want to be continually doing this every 5 seconds. So the whole entire length of this procedure should have taken 25 seconds. Okay, problems that can go wrong is sometimes if you are going very slow, or if you do all of the glue in one blob and then pull back, is you've got a period of time where the blood can react with the glue in the tip, and it can then polymerize the tip. So it's very important to get that continuous pullback. Other problems can occur when preparing the catheter, but otherwise, generally, once you're in their place, it will be very straightforward. Thank you very much. I hope it's been helpful. Bye-bye.